So I had a patient scheduled for surgery in November 2019, and it was just prior to his surgery that I saw Andrew's email and thought this is fantastic, and spoke to the patient, who was very willing to try the new rib graft, and so we performed the surgery in the end of November. I've performed a huge amount of autogenous costal cartilage grafts because I do a lot of ear reconstruction, so I'm very comfortable with using rib cartilage for all sorts of both nasal and ear reconstruction. I was aware that in the US it was being used widely, and I was very excited to try it for the first time here. Technically, I found using the cartilage was exactly the same as using native rib cartilage, which I've, as mentioned before, got a big experience with, so I'm very comfortable with using and what that feels like to carve, and I found no difference at all. If anything, I found it an advantage knowing exactly how much I was going to be able to get with the variable sizes that you can pre-order. I think there's a lot of benefits. I think firstly there's benefits for the patient, so there's the benefits of less pain, less scar on the chest, less potential deformity from harvesting their own rib cartilage, which means a greater recovery period, and less associated risks with that, which are of benefit for the surgeon. So whilst unlikely, there's always a small risk of pneumothorax when you're taking out a rib, there's a risk of infection, there's another scar on the chest which you can have all the associated problems with surgery of infection, bleeding, hematoma, chronic pain, etc. And I think the ease of use is great. I think it saves operative time as well, which is of benefit to both patient and surgeon. And the other one is often that the rib cartilage is a little unpredictable as to how calcified it can be, because I have had patients where I've opened up their chest and found that the rib that I wanted to use was calcified, and I've then had to slide down to another rib, which can be a little tricky when you're trying to maintain a small incision. So there's a lot of benefits. I'd highly recommend it to fellow plastic surgeons. I think that people that aren't used to taking rib cartilage graft can be a bit daunting, and I think removing that technical difficult part of the operation, having something that's available off the shelf, really makes it easy, and I think for the patients the benefit is also there as well, so I'd have no hesitation in recommending it. So here's Jake at 6 months, so we can see his before photos, the evident thing with his nasal dorsum. You can see he had a large collapse and a saddle deformity in this area, and in the post-op view you can see he's got a nice strong dorsum, which much better tip projection, which is really good, and everything's softening up nicely. And if you turn and face us front on, and when you see the front on view, you can see in the pre-op, you can see the evidence of the saddle nose and the collapse in the mid-vault and the widening of everything, and the deviation of the bones, and now he's got a much nicer dorsal aesthetic line on each side. Tip projection looks good, and everything's really nice and stable in there, so it looks great.